Good afternoon, everyone. This is Idalis Bailey from Global Integral Beauty. I'm working very happy, very excited with all the professionals. We have working like 3 years from 2020, and thank God, so far so good. We can continue doing this amazing networking event every month in English and in Spanish. My name is Idalis Bailey. I'm a registered nurse, an MBA in marketing, skincare specialist. Also, I have the New York State license as a medical esthetician. I'm the founder and CEO of Renew Aesthetic Medical Spa with more than 19 years, and also founded Global Integral Beauty with 3 years. I'm very excited to be part of this community. From your area of expertise, what kind of medical and lifestyle factor negative affecting the physical, sexual, and aesthetic health of the intimate area?
Well, I would have to say, I think probably the number one cause is nutritional, combined with our own genetics as to how we process glucose in the body. And we know that glucose accelerates aging, and it does that by a process called glycation. And glycation I think of as a hardening of our certain cells in our body, as well as our collagen. And if we have too many glucose molecules stuck to cells, stuck to collagen molecules, we accelerate aging of our skin significantly. Not to mention the entire body, of course, and it's a lead up to diabetes and all the consequences of that. But even long before people become or could become diabetic, many people, in fact, most people that I test right off the bat are struggling with a degree of pre-diabetes. And there's so many interventions that we can do to correct this, that you can have a significant impact on the body by being more progressive and teaching patients how to control this glucose. And people automatically think, oh, it's what I'm eating, which it could very well be, of course. However, there's a lot of genetic factors. We inherit a certain amount of how we process this sugar in a negative way. So if we can reduce glycation, and we can measure that in biomarkers in the blood, you're going to find that people have less skin breakdown, less breakdown of the collagen, so you can regain elasticity, all these things that are important for women's health and men's health, of course, and in particular our topic today for intimate health. I think you want to be sure that you control people's glucose to a level that is not pre-diabetic for the absolute best results.
From your area of expertise, what kind of medical and lifestyle factor negative affect the physical, sexual, and aesthetic health in the intimate area?
So for me, I think there's been an increase in the number of people who have presented with vaginal prolapse, and obviously that affects the aesthetics of the intimate area, and we're seeing a vaginal prolapse in women who are a lot younger, and that's because in this day and age now we're very active. Women are going to the gym, but in going to the gym it means that they're lifting heavy weights, or they might be lifting heavy weights, and they are increasing the abdominal pressure, and as a result they're pushing down on their pelvic floor. And over time, obviously, if you are not bracing your core, if you're not doing your pelvic floor exercises, subsequently what will happen is that there is descent of more than one of the organs, that being either the bladder, the rectum, and women are actually presenting to gum clinics. They're presenting to the gynecologist with vaginal prolapse. Well, the initial symptom might be increasing urinary frequency, or maybe mild incontinence, and obviously they might feel a slight bulge, which they're very worried about, and they don't typically feel as though they might have prolapse, because it's something that is typically seen in women who are a lot older. But I think it is very important to raise awareness to the younger generation that, it is important to continue doing your pelvic floor exercises. And yes, it is good to remain active, but make sure that you are bracing your core and doing those exercises effectively to prevent prolapse in the future.
We're going to continue with Dr. Mindy, the same question.
So I'm going to come from a little bit more of the mental health point of view, because that is my area of expertise. So being a doctor of sexology, what am I working on? Helping people live their best sex life. And when we look at the vulva or the genitals, there's so many nerve endings, and that's what provides a lot of pleasure. So with my clients, there's a lot of self-esteem issues, around what one's vulva may look like, or any genitals. And I really try to steer people away from any cosmetic surgery. So we're going with the labiaplasty, the vaginoplasty, like the clitoral hood reconstruction. I always really try to steer them away from that. Why? Because you're cutting into these nerves, and that will have an impact on how you experience pleasure. So the only outside of that would be, there's pain in any way, and that's why I would really refer to you doctors. I also want to throw in here, because it is my area of expertise, all the different pieces that impact our sexual health. When I work with my clients, I'll say to them, how you have the best sex is being your healthiest self. So how do we be our healthiest self? Really trying to eat well. I ask them about diabetes, high blood pressure, any matters of the heart, right? That can impact it.
How does the diet influence hormonal health? What are the most common mistakes that are often made regarding to the food during the menopause?
So I think very, very importantly, we always have to be considering the hormones. And I kind of explain that there's pro-hormones, beneficial hormones, and sadly, those tend to decline quite rapidly through the 40s to the 50s, and then the process slows down a little bit. But even before you kind of consider your hormones, they're already declining, and we see that as early as 30, 35, and pretty significantly from 40. Then we have hormones which are increasing, which can sabotage the dwindling levels of our other hormones, and that namely would be insulin. And unfortunately, so many people become insulin resistant. And in terms of insulin, it's really important to have a perfect number. Anything other than perfect, unfortunately, favors insulin resistance and favors the glycation issues.
What type of non-invasive treatment are more effective for the intimate rejuvenation? There is intimate skincare routine that you recommend to your patient.
So there are quite a number of different non-invasive treatments that can be offered for rejuvenation of the intimate area. And typically we look, we can either go hormonal with what Dr. Lauren said, with either estrogen, systemic HRT, or estrogen gel, and that's to help with atrophic changes of the vagina. And if we move away from that, we can even consider injectables. So currently, what some people are doing are that they are using PRP, which is platelet-rich plasma, and so they centrifuge the blood, and they inject the plasma into the clitoris, and that helps stimulate collagen, that helps stimulate thicker skin, and that also helps to stimulate the nerve endings. And in turn, what it's supposed to do is to enhance the stimulation of the clitoris.
What is the sexual self-esteem? How do intimate generation treatment influence to the couple and relationship?
So sexual self-esteem can mean a lot to different people, but summing it up, I really said how you mentally and physically feel about being emotionally and physically intimate with yourself or with a partner. So thought this was kind of interesting because I would say sexual self-esteem is kind of what we're looking at. We can translate that to the libido. And everyone thought when COVID hit that everyone was going to be home having all this sex and that there would be a baby boom. Well, having a private practice in Miami, my practice filled, and I was getting many calls a day because people were not having sex. People's libidos were plummeting, which was really going against what a lot I was hearing kind of in the circulating trendy news. So one of the things that I do to help my clients stimulate their libido and just feel good in their body, mentally, physically, because how we feel the best about ourselves, that will impact our libido. So I created this little exercise that I call sexy confidence, and it's every single day. Somebody tries something that can make them feel good in their body. So a lot of women will kind of start with very stereotypic things, such as like they'll put makeup on, or they'll shave their legs, or wear their favorite outfit, like lingerie underneath their clothes, things like that. But then they really started to translate that into some of the music made them feel powerful on the inside. And then some of the activities or mantras that they were doing was just making them feel better. And they were noticing that every single day, putting a little bit of that 30 seconds of effort, or even just having a mantra in your head, helped stimulate their libido and help them just feel better overall. I told them you achieved your sexy confidence through the day if you kind of walked around, or back in the day, like walked into the office with that really good swagger, when you just feel good in the morning.
I feel very privileged to be here. So thank you, Global Integral Beauty, for having me here. And it was just, I think it was a really encouraging event. I've learned so much from this networking event. I've learned about how glucose and glycogen can affect the intimate area, and how, self-esteem and sex is just not about what's between your legs, but also what's in your mind. And so it's nice to kind of butt heads and bring all of the concepts together, and I guess encourage women empowerment. So yeah, it's been a really good event.
I love this experience. I think the others would agree that what we do each day, day in, day out, is on a one-on-one basis, kind of with the door shut. And all of this information and knowledge and discussion there's really not the opportunity to do that in our day-to-day. So to have the opportunity to speak wider and further, and to people that you may never have met before, is huge. And it really, really should, all these years of experience and observation of patients and how they get results, we really should have this opportunity to share it widely and wider with each other. So thank you for that opportunity.
Thank you. I completely agree with what you said, Dr. Lauren, about we are very isolated. And I also have a networking group here in Miami that I started with therapists in private practice. And these times are important. It's quality time. And I have to say, I also learned a lot from both of you, like being in this world. I don't branch too much into the biology of it. So I really appreciate learning all these different things. And I'm going to go research more. And I don't know, maybe I'll be sending some clients your way, or at least to talk to you more about these programs.